Hello, I'm Kelly Dean, National Executive Director and co-founder of abuserefuge.org. Today, we're going to be talking about the coronavirus, or COVID-19. In today's chaotic environment, no one really knows, but let's talk about what we do know. Abuse comes in many forms, but one category of abuses we commit on ourselves includes stress, panic, fear, delusion, and the threat of being infected by the coronavirus, all of which detracts from your ability to fight off this highly infectious and contagious virus. Self-abuse in this case will weaken your immune system and cause you more problems than you would have had you not seen this video. The coronavirus did originate in China, and it's called the Wuhan virus. It was cross-transferred through several animal species, and then it mutated to man. Everyone's immune system has the ability to develop fighting mechanisms and reactions to viruses and bacteria. What we don't know is how bad this virus will become, nor do we know what the overall impact is going to have on our global society. Unlike other viruses that are well known, such as influenza and polio, doctors and scientists can pretty much estimate the trajectory and the contagion rate of those kinds of viruses. With any new virus, however, like COVID-19, only time will tell. Recently, a group of German scientists followed infected subjects for 10 days. When the subjects were initially infected, they were found to have over 10,000 times more of the virus in their system without any symptoms than that of the common cold or flu. This led initial assessments to be made that this was highly contagious. Here is something we also know. We are all aware that our physical condition, our diets, healthy or bad, the condition of our immune system, and our overall physical hygiene all play a vital role in our surviving this pandemic. Additionally, we know that SARS, MERS, and the Spanish flu were some of the most deadly pandemics of the 20th century. What made these pandemics so deadly were, like now, the lack of public awareness, the inept response of the national governments, the uncertainty of the nature of the spread, and the contagion rate of these global pandemics. The Spanish flu was mainly proliferated during World War I by soldiers from the battlefield, medical staff in hospitals, clinics worldwide, and population's sheer ignorance about the pandemics. Over 100 million people died from the Spanish flu alone. MERS and SARS both originated with the same pathology as did with the recent outbreak of the coronavirus. So basically, they were transmitted from a succession of animals to humans. We've been told all of our lives to wash our hands before we eat, and some of us have been told not to put our hands in our faces. Not only will putting your hand in your face cause the spread of bacteria in your face, and worse than any case of blemishes and outbreaks, but also it's the fastest way to transfer viruses from your hands to your system. You see, your hands are considered to be one of the hardest surfaces on your body and resilient to many bacteria and viruses. However, the caveat is that viruses and bacteria both live on hard surfaces longer than it does than any other surface, to include your desk, chair, hands, the railing in your hallway, turnstiles, escalators, and the like. Therefore, we all inadvertently touch something all of the time, but if we can just keep our hands out of our face, eyes, and ears, we stand a better chance of not contracting the virus. However, here's the bad part. This virus is airborne. So we must take great care and precaution, especially in large groups, not to find ourselves in enclosed spaces, as well as in open air events as seldom as possible. Here's some more bad news. Chances are we are all going to contract the virus at some point in our lifetime, just as all of us have probably contracted the Spanish flu, as well as many types of cold and influenza from around the world. You're probably wondering why the Spanish flu didn't kill you when you contracted it. That's because around the mid-1950s, the virus had mutated so much and generations of humans died off and were born, creating resistance to the Spanish flu. Now, many other factors played into that, but this was the bottom line. It will take decades, just for SARS, MERS, and COVID-19, to reach the level of immunological resistance as was with the Spanish flu. We all must brace ourselves for what comes next. Stress, fatigue, a general sense of uncertainty will all wreak havoc on your immune system and your ability to fight the coronavirus. We should all stay calm and as pragmatically sane as humanly possible in order to give ourselves a fighting chance. So keep your hands clean by washing hands regularly for at least 20 seconds, as long as it takes to sing the happy birthday song twice for kids. Before eating meals, using the restroom, common sense activities, but also clean surfaces that you use often, such as your cell phone, which we always forget to sterilize, door handles, keyboards, mouses, steering wheels, bathroom handles, light switches, you get the idea. Also, it is important to note that keeping your hands away from regularly touching your face and nose is paramount. Eat nutritional foods. Now's a great time to go on one of those health kick diets, and be respectful of others when you're coughing or sneezing to use the inside of your elbow to shield the airborne contamination possibility. Of course, getting exercise, staying away from processed foods, taking vitamin C, and a good probiotic are also great ways to keep your body healthy. Something you may find interesting but haven't heard anyone talking about in the news is intravenous vitamin C. This is already being employed in China against COVID-19 coronavirus. Richard Z. Chang, MD, PhD, has been reporting from China about the first approved study of 12,000 to 24,000 milligrams per day of vitamin C by IV. He recommended vitamin C for immediate use in prevention of this virus, as it has been seen as very promising for both prevention and in treating dying patients, with there being no current vaccine available. Vitamin C has been shown in virus killing and prevention of viral replication, along with being a prototypical antioxidant. From those that have already died from the virus thus far, in most cases it is a result of acute respiratory distress syndrome, or ARDS, that is causing these deaths. There is a lot of great information in this article, which I've included in a link in the bottom of this video to learn more. What I find to be deeply concerning, however, is that the news of vitamin C research for COVID-19 is being actively suppressed. Even Facebook is blocking the sharing of this approved vitamin therapy research in China by the Chinese government. Now, on to probiotics. You may be asking, why a probiotic? Well, the gut makes sure that we have the proper microbes that are important for our body while clearing those microbes that contain pathogens. With that said, a probiotic can play an important role in keeping our immune system strong. Lastly, this virus has a higher than normal contagion rate. It can be passed on by people with symptoms and without symptoms. So shaking hands and giving hugs should probably not be the greeting protocols that anyone should use until the coronavirus can be somewhat figured out. A fist bump or no contact may be best. Panic and stress will only do you harm. There's nothing at present that can be done at trying to protect yourself other than staying in physical and mental shape during these difficult times. I sincerely pray this video helps. Be sure to share this video with loved ones and hit the subscribe button, as we will bring more video updates and new information as we get there. Please support us with donations at abuserefuge.org. Also, please click on the link on the YouTube channel. Do not hesitate to contact us if you need us. That's why we are here. Breathing life into those who need it. I'm Kelly Dean, National Executive Director and co-founder of abuserefuge.org.